All right, I'm Sean Felstrom, back here with Christian Santana.
That's right.
We're gonna go over kind of like a lot of the things that we see typically with like lower back pain, common like complaints we see from patients, and kind of how we address it.
Yeah. So again, wide population of our patients, again, like he just said, have back pain, and you start to think, what is the cause? And after that, you want to kind of figure out what to do for it. So first, what we see is a lot of cases it may be, as we were kind of alluding to before, as we're just talking on the side, is a lot of our patients are bound to their desk or they're driving.
Right, that's what I was doing.
So when we're driving a lot or in the desk seated a lot, oftentimes we end up in a lot of flexion, okay? In the back, in the hip, and that can cause a whole host of issues, especially if it's kind of chronic, which for most of our patients is their job on a daily basis. So then we go ahead, ask that question. Obviously our therapist will go ahead and give them an evaluation and kind of see what's going on there. What is the diagnosis? So that way we're just not kind of shooting in the dark.
So the other half of that is patients who we see picking up improperly. So today we'll go over a lot of the ways that we kind of address lower back pain complaints, and then a lot of the ways that we kind of help correct posture, correct how you pick things up. So we'll be going over like things like hip hinge. Hip hinge is a huge one.
Absolutely.
We promised you videos for this, so I've got different ways that I teach hip hinge. Christian's got different ways he teaches it. So we'll get a bunch of different aspects on that, and then kind of the whole spectrum of back pain and different exercises you can do depending on how they're describing their back pain.
Yeah, absolutely. And just to end it, we're going to talk a little bit about anatomy. Not too much because then it could become very long-winded. We'll mention the main muscles that are contributing to most of the motions, so that way we kind of have that functional anatomy portion of it as well to go along with the educational aspect. But yeah, we're going to get started, show you some videos, and hopefully you're excited.